So I've been experiencing some level of chronic pain for pretty much as long as I can remember. Growing up, it may have just been little things like acid reflux or, I was nauseous all the time, but there's no specific answers for anything. But when I was 13 is when I started to really start noticing symptoms and start feeling pain because that's when I started my period. By the age of 16, I was missing school on a monthly basis and I was experiencing pain all the time on my period and also just everyday life. And everyone just told me that, just hormones, you're becoming a woman and, you're going through your menstrual cycle. And this is just the pain that you're supposed to deal with. Unfortunately, my pain was much more intense than a regular 16-year-old's and I just didn't realize it. I went to Sam Houston State University for acting directing and I was a dance minor. So I was training every day, very active major. And I did great the first year. It was awesome. Obviously, like when my periods hit, I would be down for about a week and, I tried to, get through it. But by sophomore year, that's when things really started to take a turn. And I started to basically just after every single dance class I had, the pain would set in and then it just wouldn't go away unless I recovered for, like a whole week. But that was not something that I could do training every day. So the pain just kept building up and building up and building up until I couldn't handle it anymore. Basically, my body just purged everything in my system. And so they're like, oh, you must have food poisoning, a virus, and it, went away in a couple of days. And I only experienced 3 of those between my freshman and sophomore college years. But then once I started at UT, I was having them at least 3 times a month. And so then I started looking around and doing more research, and I started talking to my coworker who had endometriosis, and she was just telling me about her symptoms, and I noticed a lot of parallels. Eventually she was like, I think you need to ask your doctor to see if you have endo. The reason I had to have surgery is because you can only diagnose endometriosis through laparoscopic surgery. And so laparoscopic surgery is minimally invasive, which is great, but it is still surgery. You still have to go in, you still have to be put under, it's still a whole process. And so when I woke up, they told me I had a lot of endo and that they got it all out, and I was so happy. The symptom relief only ended up lasting about 2 to 3 months. And then I started having those really bad flare-ups again. And then by August, I was hospitalized. And so that's when my OBGYN referred me to a gastroenterologist. And they said that it must be some kind of gastrointestinal problem because I was having so many cramps and I was having, these really bad vomiting spells. It at least got my parents' attention more so because they were like, oh, okay, something's definitely wrong. And so as we were going to these gastroenterologists, they were pushing medication. Between that March and August, it was like late June, I ended up losing like 20 pounds in like 2 weeks. And then the doctors really took notice and started to believe oh, something serious is going on. The whole time my mom and I were asking, could it be her endometriosis? Could it be this? Does she need to get another surgery? Does she need to get this looked at by another gynecologist? And everyone just said, no, you got it fixed. They just looked at the records and they thought it was fine. This was the point where I really transformed from a patient to an advocate. They kept doing the colonoscopies and the doctor came in and told my mom, there is nothing that warrants her pain. The explanation must be psychiatric. And that's when my mom was like, all right, we're leaving. They told me I had a slight gastroparesis, but that couldn't have been what caused all of the pain. I knew that there was something more. So at that point, I was just ready to get out and go home. And, I did have some medication that was helping me finally, that they were able to give me. I still knew that there was definitely something missing. And that's when I was like, I really think it's endo. And I started hardcore researching. My now late partner, he was such a big encourager of, no, something's wrong. No, this is not normal. Just having someone there to tell you, like, hey, this isn't normal. Hey, you shouldn't be feeling this way, was a huge step forward in being like, oh, okay, I do need to start advocating for myself more. I was so happy to meet Karen. I met her through Jacob because they actually dated when they were both living in Houston, but it was very short and, it was very amicable breakup. Her and her boyfriend came in and I got to meet her. And she also dealt with her own pelvic pain and her own journey of not being believed. Lo and behold, she sent me to her former surgeon and gynecologist, and she immediately replied back and said, oh, well, I'm happy to see her, but my partner at the practice she called her the endo queen, and said, I definitely recommend that you go to her because she's dealt with a lot of endometriosis patients. I went in and that turned out to be the surgeon that drastically changed my life. Unfortunately, I still have some spots left, and that is why I'm still definitely fighting daily chronic pain. And I'm still having flare-ups. They're not as frequent, which is great. I take my blessings where I can get them. She definitely improved my day-to-day life. I can definitely do more than I did before, but I still definitely have those moments where I need to take a break. This is why I started the blog that I did, and I started speaking out on Instagram through my Misdiagnosis blog. And it really came out of just me wanting to share with people and share with anyone else who might be struggling to find a diagnosis, is that your body better than anybody. And patients shouldn't have to convince healthcare professionals that they're in pain. They should just be believed and evaluated. So if a professional isn't necessarily listening to you, they probably aren't the best one to care for you or to give you the treatment that you need.